Okay, good afternoon everyone. Today, I'll be dealing with the topic of presbyopia correction, the present reality, a few options. So the presbyopia has everything, but nothing to do with age. Not only the age procedure, like it can be done along with a routine cataract surgery, a pre-senile, or a complicated cataract, or with a pediatric cataract, or a refractive lens exchange corrected around the presbyopic age. So there are multiple options available. It can be a trifocal, it can be a continuous range of vision, EDOF lenses, enhanced monofocals, laser vision corrections options like Presbymax, Presbyon, presbyopic ICL, or a corneal inlay procedures like camera rings, raindrop, presbya, or a outdated scleral expansion bands. So if you are doing it as a routine IOL procedures, the prime importance is for the proper centration of the lens. So there should be a correct capsulorhexis regular with IOL inside all the rhexis margin and the corneal Purkinje images, so that first image from the corneal plane and then from the lens plane should meet with the center of the lens. As seen in the vermilion, we can see that there should be proper centration of the lens. Now, when there is, in cases of an aged patient near presbyopic age of 38-year-old myope, where laser vision correction is not advisable, because if you are considering the case of a myope, there is a wide range of correction required. From a -2 range to a +3, there is a wide range of correction required, and there will be more induced aberration. And if ICL is also contraindicated with a small wide to wide or a low anterior chamber depth, or glaucomatous predisposed eye, we have to go for a lens exchange case. Like there should be prime importance in dealing with pediatric cataract and presbyopia. So like when we are going, if you are putting a multifocal IOL in pediatric cataract, first of all the surgery should be done by a well-versed surgeon. So there should be a carefully we should take the anterior capsular flap. The prime important is like if you are putting a multifocal IOL in one who is able to afford it, or in developmental cataract children like already have a vision, some sort of vision, it's better to put a multifocal IOL. So there will be reduced amblyopia, and there will be increased attainment of stereopsis and binocularity post-op. So after a correct anterior capsulorhexis, we have to go with the nuclear matter and cortical matter, and we have to do a correct posterior capsulorhexis. And if things are happening correctly, we can go for a multifocal IOL, and this is better for reducing the amblyopia chances in pediatric age. Now coming to the enhanced monofocal, like those where we can't go for a multifocal options, like in DR cases and all, an enhanced monofocal is a better option with a higher order aspherical surface, and a power gradually changes from periphery to the center. So it will give a good range of distant vision. Now coming to the laser vision corrections, the options are Presbymax, and here we are using a femtosecond, with the help of a femtosecond laser, we are raising a flap, and we are producing the excimer laser to create a central or a peripheral Presbymax. And other option is Presbyon. It's also a newer option where like one distant eye, dominant eye we are making distance and seeing for distance, and non-dominant eye for near vision with a blended zone. That will give a more compromised vision. And coming to the scleral expansion bands, so this is basically we are putting some scleral bands in the scleral area just above the ciliary process, and thereby creating more tension on the equatorial sonoles, and thereby dealing with presbyopia. Other option is like corneal inlays, can be camera, raindrop, or presbya. Like basically this is giving an effect of pinhole vision. So with the help of we'll make a flap, but we won't raise that full flap. Through a pocket we will inject the camera ring inside. But nowadays it's not done because of the risk of extrusion of the implant and the corneal melt. Now a recent advance is like presbyopic ICL put forward by the Star Surgical's Evo Viva. It's known as Evo Viva. Like a wide range of population is
conclude. You can just talk about this and conclude.
So like a wide range of population is waiting with a mild myopia and all, like they are waiting for a better option. This can change to be a better option for them. Thank you.
I would like to thank all my faculty and my discussants for being, and the audience for being tolerant. I'm very sorry about the glitches that happened during the presentation. Thank you so much.